So one common treatment for sleep apnea is a positive airway pressure device. The way a positive airway pressure device works is that there is a small box about the size of a bread box you plug in the wall, which generates air pressure in a very quiet way. Air pressure comes out of the machine. It goes into a hose to a mask that you wear around your nose and mouth. And that air pressure will travel here to behind your palate and your tongue, and that will help open up your airway. And it's usually done at a very low pressure. So there are different kinds of positive airway pressure machines oriented towards different kinds of patients. The most common one is a continuous positive airway pressure device known as CPAP. And that provides the same pressure if someone inhales or exhales, and is really oriented towards the people with obstructive sleep apnea, and that airway simply needs to stay open. So in terms of auto CPAP, what's happening is that the patient may have different needs of pressure in different parts of the night or from day to day. And that overall positive pressure can change over the course of the night. Another device, specifically for people with complex or mixed apnea, is a machine that is watching someone breathe from breath to breath. So if the size of each breath is too high or too low, the pressure the machine generates will be different. Some people will need more pressure or less pressure compared to others in terms of how much pressure does it take to open up the airway. And the overall concept most sleep physicians follow is to use the lowest possible pressure that solves the problem. That way it's as comfortable as it possibly can be. So positive airway pressure treatment, let's say CPAP, is typically the gold standard for treatment of sleep apnea. And that's because it's the most effective treatment. It's something that as soon as you use it, that airway is open, and you can feel the benefits of treating sleep apnea that first night. Now, the difficulty is sometimes people don't get used to the machine right away. It can take 2 to 6 weeks for people to get used to it. And since it's something that someone needs every single day, it's more like eyeglasses in the sense that once you wear eyeglasses, you have to use it every day. It's not necessarily curing your vision, just like CPAP doesn't cure sleep apnea, but as long as you're using it, your sleep apnea is completely treated. One advantage of a positive airway pressure device is that it's able to be used by people of all severities of sleep apnea. It's really a question of figuring out what are the settings of the machine to keep that airway open at night.